Begin. We are live.
Okay, sir. Thank you. So, good afternoon, respected Dipti ma'am, and all the attendees of this webinar series. I, Shruti Panchal, welcome our speaker of the day, Dr. Deepti Padole ma'am, to the PU webinar series. And I welcome you all also to join us here into PU webinar series. So let us start with the introduction of today's speaker, Dr. Deepti Padole ma'am. She is currently working as an associate professor at Sri B.G. Patel College of Physiotherapy, Anand. But it is my goodness to say that to elaborate her academics, she has done double postgraduate in Masters in Orthopedics and Masters in Neurological Physiotherapy from Meerut University and from Sardar Patel University, respectively. She has done her PG diploma in community and child psychology from MS University. She is having working experience of more than 20 years as an academics, and even more than that as a clinician. And it is my privilege to say that ma'am is actually really expertise in performing manual therapies, soft tissue manipulation, cupping therapy, and NDT approach. She is also a yoga and Reiki instructor, and she has been performed so many duties being an academician, like as a part conducted exams in the at university level in different universities, along with including Sardar Patel University, and apart from that, other universities across Gujarat and Maharashtra. So I welcome you, ma'am, from my bottom of heart to join us on this webinar series. Over to you, ma'am.
Thank you. Thank you so much, Dr. Shruti Panchal. And thank you, Parul University, for giving me this opportunity to be a speaker on this event, August event. Yeah. Today, my topic for webinar is physiotherapy in hemophilia. Hemophilia. It is a very much untouched topic, not just among physicians and orthopedicians, but even amongst physiotherapists. Exactly what is hemophilia? So first of all, it is a hemophilia. It is a there is a body, recognized body, that is World Hemophilia, which celebrates World Hemophilia Day on 17th of April every year. So this year's theme was partnership, policy, and progress. So partnership with the patients and generate certain government policies so that they are at par with the other citizens and they can progress in all aspects of life. So what is hemophilia? Hemophilia, it is an incurable hereditary disease which has a bleeding disorder. Now, why does this bleeding occur? Because of absence or deficiency of clotting factors. Now, naturally, by birth, we have certain clotting factors in our blood, but these hemophilic patients, they are either deficient or they are absent, right? So the 7th and 8th factor which is present in our blood, that is deficient or is in a reduced quantity, right? So because of this deficiency, they have repeated spontaneous bleeds inside the joint or even in the muscles. So once when a joint or muscle is affected, definitely it would lead to a permanent disability. And this disability, if not treated promptly, may lead to permanent affection. It is also called as a royal disease or disease of the kings because it was been carried by Queen Victoria of England and because she was a carrier of hemophilia. So there are around 70,000 patients of hemophilia A and B in India, okay, and the population is quite big, right? And one evidence which was published in NIH journal in 2007, which says that only 9 patients, hemophilic patients, out of 148 hemophilics were free of disability. So you can imagine the amount of disability. Other 139 patients, they lived their life with disability. So this is just a statistics about India. So the prevalence is there across all the countries of the various countries across the globe. Now, exactly what causes hemophilia? So let us see to the chart. When a mother is a hemophilia carrier, her one X chromosome is a carrier gene. So whenever this X chromosome matches with the father, it results into a carrier daughter. And if this X chromosome matches with the Y chromosome of the father, it gives a hemophilic son. So there is a 25% chance of a daughter having a hemophilia carrier and a 50% chance of a son having a hemophilia, right? So likewise, if a father is a hemophilic patient, then his X chromosome is hemophilic. So all his daughters will always be a carrier. His sons would live a normal life without hemophilia. So it is a mother who becomes a carrier. And the sad part of our nation or our developing nation is that it is always the mothers who are been cursed for having this disability in the family. So not just a medical physical aspects, we also have to fight against the social norms also of the society. So now coming down to the types of hemophilia, there are three types: hemophilia A, B, and C. A is the most commonest, which is caused by factor 8. B is caused by 9 factor, and C is caused by the 11th factor, which is very rarely seen. Now there are various severities. There is a mild, moderate, and severe. Majority of population, that is 5 to 50%, are in the mild category, and moderate categories are just 1 to 5%. And these patients in a moderate category, they have spontaneous bleeding, which is uncommon, but because of some trauma or surgery, they come to know. Okay, and severe are less than 1%. The population is less, but the severity is very severe. They may have spontaneous joint or soft tissue bleeding several times in a month. Okay. So what are the which joints are affected? So the joints that are affected are knees, ankle, elbows. So the joints of hands are not usually here affected, but except if they any get injury. Joints, these are the joints which are commonly affected, right? Coming down to the muscles, muscles that are affected are majorly iliopsoas and quadriceps. Iliopsoas, that is a hip flexor, quadriceps, extensor muscle of the knee joint, right? So this is a chart. So is hemophilia lifelong? Yes. Hemophilia is a lifelong disease because the level of clotting factor, it is a genetic, right? So it stays same throughout his life. So the level that is mild will remain always mild. A severe person will remain always a severe. Or a person who is deficient with 8 factor will always remain deficient with 8 or 9 respectively. So what are the signs and symptoms? There are early and late signs and symptoms. So earliest are tingling sensation and there is a feeling of warmth. And in late, there are difficulty is in walking or movement. There's a pain whenever the person tries to do a movement. There's a tightness or swelling, numbness, and tingling sensation. So those are the difficulties, right? So whenever you would see a patient with hemophilia, this kind, it would be seen a swelling, voluptuous swelling is seen onto the patients. Very often they are affected with knee joint. Majority of the patients you would see knee joint. Also, some patients, they may have some internal bleeding. That is a bleeding inside the vessels, damaged vessels or organ inside the body. Or external could be because of some injury. Right? So coming down to these joints, why these specific joints? Knee joint, ankle joint, elbow joint. So there is something peculiarity amongst these. These are hinge kind of joints. So they have only 1 degree of movement. Now, since they have 1 degree of movement, they are not surrounded by protective muscles. And so that causes affection. They are more susceptible for affection. Okay. So during the acute phase, there is a warmth, palpable swelling, tingling, as we discussed, discomfort, stiffness. Now, how does an acute muscle bleed occur? So this occurs because of direct blow, sprain, or sudden stretch. Or a spontaneous bleed may be because of any reason. The patient was just sitting, very often would give a history, and suddenly he started feeling warm, pain, and the pain is there in the iliac fossa, the muscle, iliopsoas, right? And patient has difficulty in turning, sitting, standing. So the symptoms of muscle bleed are aching. Since it is a muscle and the blood is an irritant, it acts as an irritant. So the muscle undergoes a spasm. There's a trouble in movement. It starts feeling warm. Tightness is there, stiffness is there, and very often the area becomes bluish discoloration. Okay. So these acute bleeds, they should be treated as fast as possible within 2 hours. Okay. And very often by the time certain patients, they start recognizing these symptoms and they call it as an aura. So physiotherapy is a beneficial to regain increased abilities and the function. So by physiotherapy, we can minimize the disabilities by using certain electric modalities and proper exercises, along with the help of drugs and surgery. Okay. So here the purpose of physiotherapy is to relieve pain, reduce muscle spasm, soften contracted tissues, maintain the muscle power, increase the proprioception sensation. Here the proprioception sensation is very, very important because that would correct the joint position and also the muscle integrity around that joint. So as a physiotherapist, our goal is to treat the muscle imbalance, reduce the pain and improve the functions, improve the flexibility, correct the muscle imbalances, improve the stability, correct the posture, give proper posture training, and also correct wrong or harmful movement patterns. Here it is very, very important because any wrong pattern of movement will again result into a new bleed, which will cause a setback to the progression. So we have to correct the altered biomechanics and prevent the damage. So what can be done during the acute bleed? We all know, we have heard about PRICE, right? Protection, rest, immobilization, ice, compression, elevation. But here R is replaced by replacement of a missing clotting factor. Rest is definitely required, but apart from that, whatever is the clotting factor is missing, that has to be given intravenously. So as early as possible, the IV is given, the factor is given, the condition would improvise, right? So why protection is important? Because to reduce pain and to minimize the another injury. Because if a joint is under a bleed, it would cause, there is a high chance that the re-injury may occur in the second bleed. Because what happens, maybe within 2-3 days, the pain may subside and the patient may start walking or start moving. So if the joint is not in a proper position, protected, so the other joints will be working in a faulty manner. And that will result into a new bleed in the joint. Similarly, a muscle is at a highest risk of re-injury in the first 6 weeks. So same as the pathology, if a muscle is bled, then it will try to compensate with another compromising mechanisms or compensations. So again, that will be causing a new bleed. Okay. So replacement factor is important, but at times the patients may not be able to avail it. Okay. Immobilize. So immobilization should be given in the form of non-weight bearing. Use of crutches and splints if it is for lower limb affection. For one can give static splints in the form of thermal plaster or back slab, not whole POP. Why? Because that may cause compression and cause pain. Okay. Splint should be used for comfortable position and comfortable range of motion. During this acute phase, no sports are allowed, no activity, and the patient is allowed to move within a pain-free range only. If a patient is with iliopsoas bleed, then definitely he has to take a bed rest. Okay. ICE protocol, here ICE plays a very important role. Very often we see use or see the patients being given the cryotherapy. But here cryotherapy is very, very important because the for these hemophilic patients, the cryotherapy may extend for not 10 minutes, 20 minutes, but for almost whole day or maybe 2-3 days. So for that purpose, it has to be applied in a specific manner. You should make a gutter or a channel with a Macintosh or a plastic sheet. Apply oil on the part which has bled, and then on top of it, apply the ice or ice towel or a cold pack. Now, why ice towel? Why this mechanism? So, gutter or a channel, it will help to drain off the fluid, water. Whatever water is formed because of the ice melting, that should drain off. Otherwise, it will collect over there and it will moisturize the skin. Now, if there is a cold water around that, that may cause the frostbite or cold chill burns, right? So also the oil should be applied so that the water does not remain onto the skin or it does not come in contact and it may seep off the skin. Okay, so this is a specific method by which ice therapy should be given to these patients. Okay, and so a towel should be used as a barrier so as to avoid any ice burn. Okay. And this cold pack should be applied before and after exercise, whenever exercise sessions are started or patient is allowed to do some activities. Compression. So compression helps to slow down the bleeding, reduce the swelling, reduces pain, limit the movements, and one can use crepe bandages. The crepe bandage or whatever compression you are giving, it should not be too tight so as not to cause any damage. Rehabilitation, it can be started as early as possible. Okay, as soon as the bleeding stops, the rehab part can be started. So the target joints are likely to return to pre-bleed state. Okay. So during the acute stage also, once the patient is comfortable, the gentle static muscle contractions can be started as much as the pain allows. Okay. The number of repetitions should be just 5 to 10 contractions 2 times a day. That is good enough to maintain the muscle physiology. One can progress later to 15 contractions 3 times a day as when the pain reduces, swelling reduces. Okay. Active range of motion. So active stretching here is important. You should teach the patient how to do the movements, range of motion, and try to stretch it on himself. Okay. Hold and relax stretching. By you can ask the patient himself to do actively bend and hold that position, maintain that position. Okay, so that will help to improvise the flexibility of the muscles and improve the range of motion. A hold for the stretch can be given for 10 to 15 seconds. For prolonged stretching, one can use serial splinting, but it has to be very gentle, carefully applied. Okay, stretches. So stretches, they can be given, but again, one has to be very, very careful. Amateur physiotherapist may cause a new bleed, so you have to be trained properly how much pressure to give. It should be just comfortable to the patient, because it should not happen that you are very enthusiastic. Yes, in one session I'll increase the range or correct the all tightness. No, it cannot be given that way. You have to be very, very careful. So active stretch is the best. Observe the patient, what range he is comfortable, and accordingly only one can go for it. Okay. Strengthening. So muscle strengthening exercises should be started because they are weakened after immobilization and rest. So isometric can be started in the acute stage, which can be progressed to free active exercises in inner range, then movement in a gravity eliminated, and then against the gravity. So that will help to gradual progression of the strengthening protocol. Proprioception. So proprioception, it is a sense of posture, movement, and change in equilibrium and knowledge of position. So it gives the person a feeling how the joint is positioned. Okay. So it is very important to restore because it is a very good exercise for dynamic balance. So here you can gradually start with making the patient stand with eyes open and then closed, one leg standing. Also, gradual progression, you can do walking on uneven surface, hopping, skipping, and stay climbing later on. Weight bearing status. So initially there is non-weight bearing, which is progressed to partial and then full weight bearing. Once the person resumes ADL, that is activities of daily living, the muscle usually regains its strength without difficulty. And in such cases, swimming is a very good exercise for hemophilics. Why? Because with the effect of buoyancy, the swimming helps to reduce the joint pressure. Okay, and it assists in the movements. So that helps to give a good exercise. Then physiotherapy aims. So one has to educate the patient and his family. What is the importance of physiotherapy? What is the importance of joint protection? Once when they are educated, they understand how to protect so that the condition doesn't worsen and disability does not increase. Okay, so you have to teach the patient how to assess, monitor the joint status, and he also has to be a part of the disciplinary team. Okay, because without the patient, his knowledge, patient himself knows what is his status. Because for any therapist, it would be a new thing, right? But a patient himself or the family members know very well what is the status, what is the strength levels, and so they have to be a part of the team, right? So as I mentioned, this hydrotherapy, it is a very good exercise. Okay. So hydrotherapy, how it is treated, it is apart from physiotherapy, you require a blood plasma or the factor. So how is this factor achieved? So a whole blood is taken, from that plasma is extracted. Again, from the plasma, cryoprecipitate is separated and a factor concentrate. So you can imagine the time and the instrumentation that is required and the expertise to extract that factor concentrate from a normal blood. And then this factor is injected to the patient's body, right? So then coming down to the subacute stage, so same exercises, isometric, active exercises, and free exercises as pain allows. Right. Now, during the chronic stage, one has to go for mobilization, that is exercises to improve the range of motion, then strengthening to get muscle power, stretching exercises. You have to teach the patient self-stretching, and modalities like ultrasound or electrical therapy. You can use them. Right? So commonest complications that are seen are hemarthrosis. So you could see this here in the left knee. It is so much wall up to us. So very often it is painful, most physically disabling, economical, and psychologically it is disability. Why? Because the child is growing and child is playful, but he cannot play like his peer groups, right? So it is a great trauma, and he himself starts focusing him, or undergoes a lot of inferior complex. So these hemarthrosis are the commonest thing that they may come to you for a treatment. Okay. Assistive devices that can be used are orthotics like AFO, KFO or caliper for lower limbs, for upper limb, cock-up splint, elbow support or dynamic splints or elbow crutches, they can be used. Lifestyle and home remedies. So certain modifications they can be done. They can be done by exercise regularly as prescribed by the therapist. Okay. Also, you have to educate the patient to avoid certain medications like aspirin or ibuprofen. Why these medications? Because these are acting as a blood thinner. So already the patient has a clotting problem, and this may cause any kind of injury, may cause vigorous bleeding. Okay. Also the heparin and warfarin, these are anticoagulants. So they should be avoided as far as possible. Then all these patients should be advised for good dental hygiene. Now, why good dental hygiene? Because for a normal individuals, going for a dental checkup is very easy. But for these hemophilics, this is also one cause for a bleeding, and it may be an absolute emergency. So it is always prevention is better than cure. So dental hygiene is very, very important. Right? So these are the kind of factors which are available, right? And this one vial, it costs around 33,000, right? So some patients may require 1 bottle, 2 bottle replacement factors. So you can imagine the cost that is behind this condition. Okay. So very often these hemophilic patients, 80% of the patients, they have musculoskeletal problem, 20% patients have CNS problems and other organ systems. So uh, previously, since the factor was not available, it was given only on demand. That is, whenever the patient suffered a bleed or a hemorrhage. Okay, but what happened because of this? Many of the patients, by the time they reached the second or third decade, they had lot of hemophilic arthropathies. Okay, a person who's just in a second or third decade, that is just in a teen age or young age, and they're with lot of disabilities, right? So that was the status. Nowadays, now since this factor, it has been produced over here in India also, so it can be given, and it is given on a continuous prophylaxis. That is, it is started at a primary level or even at a secondary level. That is, as soon as the child starts walking. Okay, very often these children, they have joint bleeds the moment when they have teething. You know, the teeth comes out by the age of 5th or 6th month. How the gums, they just rupture and the teeth comes out. For a normal child, it is, for a parent, it is happiness to see the child teething. But for a hemophilic parent, it is a painful, because there's a bleeding for severe bleeds. Okay, or when the child starts crawling, the knees are swollen, black or reddish and bluish. Okay, so such children, they are given with primary this continuous prophylaxis. Whether they get an injury or not, they are given the prophylaxis. The pain management, any intramuscular injection should be avoided. Okay, why? Because this may cause hematoma. Also, aspirin and this NSAIDs, they should be avoided because there is another chances GI bleeding, gastrointestinal bleeding. So any complications should be avoided. The COX-2 type of agents, these are the second type of NSAIDs which are beneficial and effective for articular pain and swelling. So they can be prescribed. Okay. For surgeries, whenever it is a case of surgery, spinal anesthesia is avoided because there is always a chance of intraneural hemorrhage. So it is always a general anesthesia which is preferred. And if at all it is a planned surgery, double or triple surgical procedures are done in one session itself, so as to avoid the cost of clotting factor. Okay. So during the surgery, whenever it is a planned surgery, before the surgery, 100% level is achieved for the factor. The factor is infused. Then for the next 14 post-operative day, 60% of the level is maintained. Okay, that is during the healing phase. That is during the scar healing formation. And during the next 10 weeks, 30% of factor is given. That is during the exercise session or the rehabilitation part. So till that time, the factor cost has to be borne. So it is not just the surgical cost, but even the factor replacement cost is added to these surgeries. So very often patients will have, whenever you see an x-ray, these kind of x-rays would be seen picture just for a 18-year-old boy, 20-year-old boy, right? This looks like such a old patient's x-ray, but these are of a young patients also. Okay, so this synovitis, you can see the joint space is reduced badly. There is so much of osteoporosity. Okay, the joint alignment is not proper, and it is towards the fixed flexion contracture. Okay. Another option that is there is radiosynovectomy. So very often these patients, whatever the cartilage is thickened, so that has been excised using isotopes, radioactive isotopes. That is a radioactive synovectomy, which is relatively simple, virtually painless and inexpensive technique. It is very beneficial for knee joint, elbow and ankle. I've seen patients being operated by this radioisotope, okay, and they recovered very well. Functional, they got good functional ranges post this surgeries. These surgeries, they are done by specialized orthopedic surgeons who are specifically trained in hemophilia. Any other orthopedic surgeon would not be expertised into this. So there are very few centers, even in India, those who do this surgeries. Okay. Hematomas or the muscle bleeds. So this kind of, you can see here in the top figure, you can see the calf, how it is swollen, bulky, shiny, and right. And this is a knee joint, how it becomes elbow joint. Sorry, this is how it becomes big. Okay. So this muscle bleeds, they may compress vital structures. Okay. If there is a tongue or a throat or a neck bleed, it may obstruct the airway, which may be again a second complication. If there is an arterial, then that may cause gangrene, ischemia, contractures. Okay. And there would be complications in the calf and forearm. Also, there are psoas hematomas. Psoas, that is psoas major muscle on the right side of the abdomen. So this may make like acute appendicitis. So if a person is not, there is always a differential diagnosis for this acute appendicitis, or some may have retroperitoneal hematoma. So that is, it can dissect through the diaphragm into the chest, compromising the airway. So the airways also may be compromised. The bleeding may progress up. Okay. Also, this may cause affection in the renal functions because of compression on the ureters. So pseudotumors, they may look like this onto X-rays, okay, which is commonly seen in the thigh. Patient will have pain around the hip joint or in the thigh. Okay. So for management for this pseudotumors is surgical excision management, irradiation and embolization is very important. For this major hemophilia centers, it is very important that this kind of surgeries, they should be done in a multidisciplinary surgical team where recognized hemophilia centers are there. Okay. One such center I know, which is there in Pune, where I did my graduation. So there we used to get to see these patients post-operatively. Okay. Fractures amongst hemophilics, these are common because they have an active lifestyle. Apart from those, despite of these disabilities, they have a very active lifestyle. Okay. So for such fractures, POP are not recommended for risk of compartment syndrome. Rigid internal fixation or external fixation is useful. Okay. If the surgery is done properly, correctly, then these patients also may progress, recover like a normal individuals. Okay. And the healing time is similar for fractures. Now, very often these patients, they have so much of joint defects, right? So because of that, arthroplasties may be planned. So arthroplasties are a choice for improving the quality of life. But prior to that, the status of the inhibitor status is very important. HIV level. Why HIV? Because very often these patients, they are being given blood, or if the testing, some patients, they may be, sorry, some patients, they may be given some blood transfusion, so they are at a very high cost, high risk of HIV. So any infections like hepatitis or HIV, they should be checked out. Okay. Also DVT prophylaxis, that needs to be checked. And if at all any arthroplasty is planned, then two procedures, like both the knees replacement is done in one session itself, or knee along with the hip replacement is done. Okay. So that the cost factor is minimized. Okay. So whenever a surgery arthroplasty is planned, the surgeon should weigh the risk and benefits carefully, considering the clinical and immunological status of the patients. Okay. Failure to respond to factor replacement indicates that there is an infection. So this infection should be aspirated. Immediate aspiration should be done, and proper laboratory testing should be done. Okay. Although continuous prophylaxis can slow the development of orthopedic complications, these complications still arise in amongst the patients. Okay. And HIV infection is the commonest risk for these patients. So summary coming down, physiotherapy is very important for these hemophilic patients. Hemophilia, there's a healing process occurs good with rehabilitation techniques, and it also helps to reduce the episodes of plague. Okay. So working, it has to be always a team work with the patients with hemophilics. That is very advantageous. That helps to make the patients alert, family members alert, and aware about the cause. Okay, proprioception is always the best part of the treatment, and exercise is very, very important for patients with hemophilics for life. These are the patients who, famous personalities who suffered with hemophilia, right? Also, since 2016, this hemophilia has been included amongst other disability conditions under the Indian government, so a Disability Act. So these patients, they also have the benefits of disability card if the disability card is done at a civil hospital, right? So they get the benefits of free factor replacement at civil hospitals, free physiotherapies at civil centers, right? And along with that, they have good opportunities for education and job recruitment, right? So that's all. Thank you. Thank you so much.
Thank you, ma'am, for your insightful lecture.
Yeah, thank you. You're
Thank you.
welcome.
It was pleasure having you, and we hope that our student get to know something very informative about hemophilia. Thank you, ma'am, for your time. Thank you very much.
Thank you all. Thank you so much. Thank you for this opportunity. I would thank Dr. Bhavna Gadvi ma'am, Principal Dean of Parul University, Dr. Advita ma'am, and Dr. Shruti Panchal to be the coordinator for this today's session. Thank you.
Thank you, ma'am.
Any queries? Any questions?